Our mission at UCSD is really to help develop the next generation of leaders in infectious diseases.
There were really a few things that I was looking for when I was looking for an infectious disease fellowship program. Certainly one was that the program had excellent clinical training, and that's a definite strength of UCSD's. There are 3 hospitals.
From the Jacobs Institution or hospital with advanced cancer care and bone marrow transplant. We have VA, which has sort of your classic VA patient, but also just an amazing opportunity to see universal health care, single payer health care. Our Hillcrest population is just an amazing opportunity to serve the county.
The Owen Clinic is an HIV primary care clinic at UCSD serving over 3,500 people living with HIV. It's one of the largest in the country.
So I think those 3 training sites, combined with also our clinics, just make for an outstanding clinical opportunity.
I've been astonished by the amount of hands-on teaching that there is within the training here. The didactic training at least 2 or 3 times a week, and on the ward teaching has been really outstanding, and the time that is dedicated by the faculty is astonishing, and I'm really starting to appreciate that as I take on teaching roles myself for the junior fellows within the department.
We're exposed to a vast array of pathologies, and we have bone marrow transplant and solid organ transplant that we staff on as infectious diseases. I think that's really helpful for us trainees.
When you rotate on those services, you really feel like you're a part of the team and helping making decisions, and it's been a lot of really great exposure to pretty much everything that I kind of hoped I would be able to see.
For the people that trained here and live here, they treat things like coccidiomycosis like it's an everyday occurrence, but for lots of us from around the world, it's really exciting.
I was able to see invasive fungal infections, which I had never seen during residency, and I actually saw malaria twice this year, which I think I'm the only fellow who has seen malaria this year.
And they're linking in with that in terms of infectious diseases. We're a border town, and the interaction with healthcare with Mexico and San Diego is always going to provide for interesting clinical practice, I think.
Being so proximal to Mexico and Tijuana, that there's so many opportunities for both clinical care and research in terms of border health research and projects, and that's a really unique opportunity that isn't anywhere else.
And it's not just the infectious disease division, but it's also the global public health section of infectious diseases. We have about 100 faculty, and we do research all throughout the world. We're also the largest division within the Department of Medicine.
When I came here, I really didn't know what I wanted to focus my research on, but with the help of the program directors and the different faculty and their willingness to mentor, it was really helpful for me to find my niche.
It was one of the easiest things to be able to connect with someone. Throughout the entirety of first year, I've had at least 5 or 6 people come up to me and say, hey, what are you doing next year? Would you like to be part of a project?
I've been out of the laboratory for more than 15 years when I came here, and so being able to get back into the lab and being supported in doing that was very helpful. I've been very pleased to be involved with a number of HIV clinical studies.
Right now I'm doing a lot of research in the lab on phage therapy. Bacteriophages are being used now in compassionate use cases as an alternative to antibiotics for drug-resistant infections.
The one I'm pursuing is the antimicrobial stewardship, infection prevention, and hospital epidemiology, which is especially exciting in these times. The lived experience of being a physician in a hospital, but really seeing what the thought process and the research behind it and the evidence-based medicine that kind of goes into making a lot of these recommendations.
I'm working mostly on solid organ transplant that's related to hepatitis C positive donors.
I feel like I've been around some of the world's most seasoned infectious disease researchers, and I've really learned from them, and they have a setup here that really encourages the training and the growth of the trainees to become their own physician scientists.
And so I think the piece that I would just say has been so boundary expanding has been the resources, the personnel, the ideas, the financial ability to support research.
We are the largest division within the Department of Medicine, and we're also the most diverse.
It's an honor to work alongside so many amazing female faculty and fellows, and within our division, over 50% of our faculty are women.
Women, LGBT, disabled, we welcome everybody, and that's just part of our culture that I think makes us so great in everything that we do, and to take care of each other and make sure that we all succeed.
The fellows that have passed through after we left, after I became a fellow, have been wonderful. Just as amazing, just as awe-inspiring as faculty.
Being surrounded by amazing people, really warm faculty that are always pushing you to be your best, always there to support you through your highs and your lows.
Being part of UCSD to me is being part of a team that is focused on evidence-based medicine, evidence-based practices at the forefront of research and an accepting environment. I really enjoy working here.
I think for me, one of the best things about being part of our infectious disease and global health department is that you feel like you're in the midst of things.
We're living currently in a pandemic during which colleagues such as Davey Smith and others are actually making headline news. Seems like almost on a weekly basis because of their role and involvement in clinical trials and the pandemic response. So it's really awe-inspiring to work alongside them.
I'm currently leading one of the largest national trials for treatment for coronavirus. So having UCSD backing has really helped get that underway, and the training that I received here has set me up well for that.
What I didn't always realize is how important it is to have well-connected mentors and faculty members at that institution because of what kinds of doors it opens up. And I think that's an exciting and overwhelming aspect of the access that we have here at UCSD that I wasn't prepared for, but I'm delighted to benefit from now.
What do I like about San Diego?
Weather, and weather.
San Diego, it is sort of one season. It's kind of always amazing. I thought I would have trouble getting used to it, and I've completely gotten used to it.
I have young children, and the outdoor aspect of San Diego is great.
I love the beach in San Diego.
You've got the ocean, you've got hikes that are all accessible.
My favorite one is the Torrey Pines hike, which is literally right next to the beach.
And a short drive away, you can even be in the snow.
I ride my bike almost every day. I love walking around my neighborhood. I'm right next to Balboa Park.
It's an amazing place to just go walk around, the museums.
It's a huge foodie town, microbreweries, wine tasting.
Fish tacos are fantastic, and so that's one of the highlights for me.
And then also the cultural diversity. We have this amazing city to just unwind.
It's a very easy place to live, and I think I have a really great quality of life here.
I think it's been great living here, and I'm really excited I came.